we are going to talk about the holiday season and quick tips to get holiday ready.
Yes, happy holidays, Michelle.
Happy
How are
holidays.
you?
Hi, Karina.
Happy holidays. Hello.
So we're very excited, and you said hi, Karina. So I was thinking that we were going to change the name of this show, Dr. Tom's Ask the Expert, to Karina and Dr. Tom's Ask the Expert, because Karina's been on our show, and I love having her on our show, giving her insights. For those who don't know Karina, hello, Karina.
Hello.
Hello, Karina.
It's good to be back.
Great to have you here as our medical assistant, surgical scrub tech. She's been working with me for 3 years, and actually she listens so well and has become a great source of knowledge for our patients. So that's why we keep on asking Karina to join us. And Karina, we have our office holiday party coming up, right?
Yeah,
right.
That's always an event.
Yes, it's a huge event. I look forward to it. I always
Yes.
wanted to be an event planner in my other life, and so on November 30th we're having our big dinner,
Yes, we are.
big holiday dinner, and so that's just one of the things that we're getting ready for.
Exactly.
And
Yeah.
when we walked in today at KSRO, what did we smell?
It smelled like food.
Food,
Thanksgiving.
exactly. Yeah,
All the holidays are
right.
ready. Yeah.
Michelle, what was going on today at KSRO?
Oh, we've got here in the building with all of our other sister stations, we're doing sort of our pre-holiday banquet potluck kind
Fantastic.
of
So,
a thing.
everybody's getting a holiday ready. And
Yes.
so Karina and I were talking about it, and we thought, hey, let's talk about some quick tips, to get ready for the holiday, because we all want to look good. We want to look good for those, those photo shots of the
Exactly.
team for our office. And I always, it's so funny to get photos, and I have to show them to every one of our team members, make sure that they look good before I can release it out on social media. But we're doing that. We're with our families. Maybe we're traveling, and we want to look our best. So I thought, why not ask Karina what are her tips for our patients? Something you can do, with not a lot of downtime and getting ready for the holidays. So, Karina,
Exactly.
what kind of tips do you have for us?
Tip number one: let's get you in for a hydrofacial. Let's get that skin nice and clean and glowy, ready for all those photos. And there's lots of lights during the holidays, so you just want to have this beautiful glow to your skin.
Absolutely. I think that hydrofacials are great. So hydrofacials are done by our medical esthetician, Hillary, and Hillary was supposed to be with us today. She's kind of under the weather, so hi, Hillary, out there in the radio land, and we hope to get her on the show with us soon. But hydrofacials are a great way to look fantastic. When I'm in my office, I have the corner office because I'm the jefe here, but corner office, and that's also where the patients kind of come out, where our patient coordinators are, and I see them coming out after a hydrofacial. They're all smiling. They all have this, as you said, Karina, this great glow
Yes.
on their face, and so hydrofacial, what it does is basically is industrial carpet cleaning, right?
Yes.
And we talk about the fact that when you have a dirty carpet, we use this example all the time. You go down to the local hardware store, you decide to do it on your own, save a few dollars, you get the take it at home carpet cleaner, you do it, and the carpet looks better, right? Have you ever done that?
Yes.
You have?
Well,
Okay.
yeah.
Okay. And then, you finally say, okay, I'm going to splurge and I'm going to pay for a commercial carpet cleaner, and you have them do it. Oh my God, what a difference.
Yeah.
Yeah, I mean, the carpet looks fantastic. It's moist, hydrated, it's clean, almost looks like new.
Yeah.
And so that's what a hydrofacial is.
Exactly.
Okay, so Karina, you've had a hydrofacial?
I have.
Okay.
Yes.
And so people might say, well, Karina is so young, but I don't know that it's really age specific.
I don't
what
know.
do you think?
Anybody can come in as young as a teenager who's struggling with acne. It helps with that as well.
Right.
But it's a great no downtime procedure to have in the office. It's booked for about 60 minutes, and it also feels like a spa day. You get to go in, lay down. Hillary will get you nice and comfortable. There's spa music going. It's a good thing to do.
Right.
Yeah.
I agree with you. And of the non-invasive, so no needles, anything like that, of the non-invasive things, in my opinion, it's the number one thing that you should have done if you are having an event. For instance, if you're going to speak, just went down, I was just a guest lecturer at the California Academy of Cosmetic Surgery meeting, hydrofacial before that, a wedding, okay, high school reunions, the holidays, and is there any downtime at all with this?
There is no downtime. You leave the office just looking beautiful and glowy. You even feel guilty if you won't put makeup on after, because it's just so clean. Your face looks beautiful.
You're right.
Yeah.
In fact, if you could, I might have to get a van. That might be my next business venture. I'm getting a hydrofacial van, and we'll just go around and come to your house right before you Hydrofacial Express. And if you're, going to be at your family's house in 2 hours, come and do a hydrofacial. Yeah. You would love it. Your skin is just glowing. You had mentioned makeup, Karina. So, are you noticing any trends with makeup in the world of beauty and the cosmetic world?
I definitely think we're moving to a more natural look, less makeup, more skincare for most women in the day-to-day basis. Yeah,
I would agree with you. And the conversation that I have, let me backtrack. So with young ladies, a lot of times, and if they're putting a lot of makeup, it's for a certain look that they're trying to achieve. As ladies get older, and they're the ones who usually are the ones who are wearing makeup as they get older into that kind of Gen X age or baby boomer age, if they begin to increase the amount of makeup they're using, I tell them that actually is aging. It's kind of telling, and it doesn't look very natural, and when the makeup starts to get caked on. So I would agree with you that a hydrofacial, because it cleans things, it exfoliates, your skin is glowing.
Correct.
You need less makeup.
Less makeup, yeah.
Absolutely. You're 100% correct, Karina, in terms of having this done and going to an event. So I would agree. So hydrofacial is maybe one of the very first
things that would come to mind. Yes.
Can I ask how long the effects of a hydrofacial would last?
In the immediacy, you'll see a very glowy skin the first day, but the effects are long-term because you're treating your skin. So it is a treatment. There is exfoliation, and so, you could do it once a month. You could do it every 3 months. You could do it, for the special occasion. So, yeah.
So how many days do you think that they'll have that glow? When I see them coming out of the room and they have this glow, which is wonderful.
I would say if paired with a great skincare routine at home, it can last up to a month where you feel your skin is just clean and glowy.
Right. Okay. What I'm going to say in typical surgeon style, in terms of you want that big bang, is I'm going to probably say probably 3-4 days is what you're looking at, and I would agree with you that a good skincare regimen would be good. And again, we're trying to give quick tips, so what in terms of products, in terms of products, what would you recommend pairing with a hydrofacial to kind of keep that holiday glow going?
The Quench is great. Our hyaluronic acid based, it's more of a serum to keep that moisture and keep all of your other products that are moisturizing sealed in would be great for that.
Right. So you mentioned hyaluronic serum. So thank you again, all of our listeners. You listen to us every week, and we greatly appreciate you. So you've heard us talk about hyaluronic acid, and I try to not use the word acid because it scares people.
People.
Right,
yes.
but it's hyaluronic. I call it hyaluronic gel when we use it in fillers, and that's Restylane, Juvederm, and other fillers that we use, or a hyaluronic serum. And you're right, so it's a natural component, it's a natural biological component of our collagen. It's very hydrophilic, and by saying hydrophilic, it means it absorbs water, okay? So it really increases the hydration of our skin. And it's one of the best components that we can put on our face, hyaluronic serum, and our particular, with working with our compounding pharmacy, it's our Dr. Tom Quench. Right? We don't give too many cute names, but we thought when we were trying to name this one, usually we just say, this way we just describe what it is on our labels, but on this one we call it Quench because it really describes what it does. It quenches the thirst of your skin.
Yes.
And so Karina, so we're talking about using Quench, and that hydrates up the skin. Is there anything else that they might use in terms of the holiday glow?
In terms of the holiday glow, tinted sun SPF for during the day is always great.
Okay.
We have the Dr. Tom Restore, which pairs really nicely with the hyaluronic gel. You can pair it together. That will just help you maintain the moisture in the skin. And during the holidays, it's usually cooler weather, so most women are experiencing drier skin. The changes in the weather can affect that.
So what Karina was describing, first of all, hyaluronic gel or hyaluronic serum, so that's going to really hydrate up your skin, and that's great after hydrofacial and keeping that glow. Even if you don't do a hydrofacial, it's good. And these are absolutely not, you'll spend way more money and get way less active ingredients by going to the department store. Okay, so it's, nothing's cheap anymore. Sorry, everybody, nothing is inexpensive anymore. But in terms of bang for your dollar, juice to squeeze ratio, our Dr. Tom Quench is great as a hyaluronic serum for your skin. You also mentioned Restore Renew, and what that is a moisturizer that you can put on after the Dr. Tom Quench or the hyaluronic serum, and what that has is it's a component called ceramide, C-E-R-A-M-I-D-E-S, and what that does is help to reestablish the fatty layer of our skin, or the lipids, if we're getting really technical here, but that helps to protect the barrier of the skin. So what that does, as Karina aptly said, was that it helps to seal, if you will, that hydration in your skin. So those are two simple little things that you can do. So hydrofacial, we're talking then about the hyaluronic serum called Dr. Tom's Quench, and then the Restore Renew, which has the ceramides, which can help to seal. Okay. What about if somebody has, a lot of our patients come in and they're regulars, and we love them for that. And because they are, their skin's looking pretty good. But sometimes you get somebody who maybe just, it hasn't been their priority, and now they're going to some big office Christmas event, and they know there are going to be photos, people are going to be, dressed to the nines and so forth. And so their skin's a little bit, I'm going to say, maybe suffering from pollution, just maybe not taking great care of themselves. What might you recommend?
I would recommend a peel for them. If they have, at least 2 weeks before the planned event. That is that one is going to require a little bit of downtime, maybe a little bit of peeling, a little bit of sloughing of all that pollution and
sloughing.
Sloughing.
Is that a word?
That's a technical term.
Is that a technical term? Okay, all right.
Sloughing of the skin.
Sloughing. We're going to be sloughing this holiday season. So exfoliating that skin.
Exactly.
Right. And now you said 2 weeks, and I think that's being conservative. I probably would say a week beforehand. You can get away with this as well. Remember, there are different types of peels. Yeah, we have some granddaddy of peels that, you're going to have some cosmetic downtime for about a week. And you definitely don't, you can go to work and all, but you'll be peeling a little bit like you had a sunburn. Okay. But we have other peels that are light, which still are effective, and it can help to exfoliate your skin. And in 2 or 3 days, I'm not sure that you're going to notice anything. But again, everyone's different. Consultations are complimentary. Give us a call, but you're right, you really should plan for this a week or so beforehand. So today is November the 16th, so this is the time to give us a call and meet with Hillary, our clinical esthetician, and she'd be more than happy to go over this with you. So, all right, so we talked about those kind of minimally invasive things to do. What would you say is your next, or the best thing that somebody can do?
Next best thing is always Botox and or Dysport. Yeah.
Yes, it's funny. Maybe you're listening to our shows before we made it the Karina and Dr. Tom show, because I would say, like, it's summertime, we'd say, okay, what are we going to talk about? What's kind of germane to our audience? It's the class reunions, summer going somewhere and all. And I would say, Karina, I would have someone come up and say, hey, Dr. Tom, what should I do on my 15th class, 10-year class reunion, my 30th class, my 50th class reunion. Oh my God, that was me. So, they say that, what should I do? And I'll put my hand up and I'll say, I don't even have to look at you. And my response would be Botox and Dysport. And so you are spot on. So Botox, just for our listeners who may be first-time listeners, Botox, which is the #1 brand, and we also brought in another brand called Dysport. It's a little, which is another great, we call them neuromodulators. What it does is it softens muscle movement, and typically we would use it in the frown area or the glabellar area, which would make you look angry or sad or tired. And by just injecting that area, it softens that and opens up our eyes, which is great, makes us look happier for the holidays and so forth. So that's what Botox and Dysport does.
Yes.
And so why were you recommending that? I mean, what do you think that does for somebody right before the holidays?
Well, if you're looking, if you have those, you know, if you're starting to have that frown look, or you know, you feel like your eyes look a little bit tired, we can use it in those areas to help just open up, especially for all those photos. You're going to be smiling a lot, there's going to be flash, so you want to make sure that you look nice and awake, right?
Right. Okay, so you want to have some energy for
Yes.
that, you know, as we're celebrating the holidays. And so I had mentioned the frown area as the area to have Dysport or Botox injected, and talk about it so you don't have an angry look.
Exactly.
There was actually a study, and I've mentioned this multiple times on our show, that they did a study where they took people who were clinically depressed, Karina, and half of them, they treated them with Botox in the frown area, the grimace area, if you will, and the other half they didn't treat them at all. And these were outpatient people, and so they weren't hospitalized. They were sent back out into the world, and then they came back and tested them, and however they tested them for their feelings of clinical depression. And the people who had Botox, when they came back, they scored a little bit happier. In other words, they were a little less depressed, okay? And we kind of equate that, we theorize about that, and we call it the mirror phenomena. You know, did your mom ever say to you, you know, smile and the whole world smiles at you? Did she ever said that to you? Probably not,
No,
right?
not really.
Yeah, that's because you're too darn young. Oh my God, that's because
I've heard that one, Dr.
you heard that
Yes,
one.
I
You
have.
know, I've certainly heard that. That was an old saying. Karina, you're killing me. So, but it's true. You know, you notice when you smile at someone, what do?
They smile back.
They smile
It's
back at you.
contagious.
It is totally contagious, and we know that. Now you always use this as an example. You're in line. You know, you're holiday shopping now.
Right.
There are two lines at your local department store, and in one there's a person smiling and so forth. You know, checking people out, and then the other one is somebody who looks like the Grinch. Okay, grumpy as can be. Which line do you go in?
I'll go with the happy person.
Absolutely. Even if there's like a shorter line with the
Right,
Grinch,
yeah.
I'm in the happy line, right?
Yes.
I'm the same way. So it's that mirror phenomena. And so you're absolutely right. Treating that frown area can help to really lighten up the face in terms of our continence and what we're emoting. You don't know how many people I have, Karina, and not so much in your age group, in an older age group. I've had ladies come in, and professional women and very accomplished people, and one of their comments, and you'll see if you agree with me or not, they'll say, I'm tired of looking like I'm a cranky old woman.
Yeah, we've heard that before.
Yeah, we definitely have heard that before. And that's their comment. And because they know when they look like that, they engender a different response from those around them.
Yeah.
So doing Botox or Dysport in that area, it's a simple procedure. We spend a lot of time with our patients educating them. We have highly trained nurses who do this. I also perform those treatments. I receive those treatments as a patient as well. And you can expect an effect in about 3 to 5 days. So if we're planning again for the holidays, you want to get on the books, okay? I think what our last day is, what is Christmas this
Christmas,
year?
I think, is a Monday. I think.
Is it a Monday or Saturday? Okay, I'm not sure. Oh, we should know that. So come on,
Yeah.
Michelle, you're
All right, I know.
Madam Google. What
Here we
day
go.
is?
It is a Monday. Yeah,
It's a Monday. Okay, so our last day is going to be that Friday.
Okay.
Okay, so you could get treated on Friday, and Christmas morning, nice happy face and less of a frown. Okay,
Right. Look younger by Monday, Christmas morning.
that's right. Look younger by Monday. That was definitely one of our monikers. And so, Karina, how old are you now? She doesn't like to say.
27.
She likes to say 25. She likes to lie. She's 27.
27.
Okay, so have you had Botox in the frown area?
I have, yeah.
And what did you find when you had that done? Okay, this is not a 27-year-old. Yes, she's pretty and all those things, but you have to understand, because you're listening on the radio, she has a very pleasant face. So this is not someone that you would think would be frowning.
Right.
So I think you were kind of experimenting when we did this,
Yeah,
right?
I don't really frown much in my forehead. I'm
right.
not an angry person, but my kids can't tell when I'm upset, so that's
Okay.
good. They think I'm happy, Mom.
Okay.
all the
So
time.
when you had that injected in that area, what did you find? What was your experience?
I guess because it wasn't such an area where I saw. I was very seldom about it. I wasn't, upset about it, but I also it made me feel better about my future wrinkles there. If anything, that's what it made me feel
so
better.
you were doing it prophylactically. So
Right.
I'm gonna you can hear Karina's like, maybe, maybe I got a little effect from it, and I was kind of doing it prophylactically to prevent wrinkles.
Right.
Okay. So I'm going to give you now the cosmetic surgeon evaluating his staff, so I'm got to make sure that I'm not, making Karina mad at me by asking her to do this, this, and this, and this, because she does everything for me. But what I will tell you is that what I saw on you, Karina, is one, it was that your eyes were a little bit more open. Okay. So although you don't have, quotes, a chronic frown, but what I found was on the outside aspects of your eyebrow, one of the for every action there's an equal and opposite reaction, okay, is that the outer part of your eyes opened up more. So I found that it just made your eyes look prettier, okay, so they were more open. We also know there's studies been shown that just doing Botox and Dysport that the skin looks better. Interestingly enough, by having the skin be a little more static, the skin looks better. And what Karina has commented upon is true. So, maybe you're in your 20s, I don't want 30s, I don't frown much, do I really need it there? But we're talking about what's our number one, why is this our number one recommendation before the holidays? Well, okay, for those who frown, for those of us who are older, absolutely decreasing that frown is huge. Okay, so that's huge. Younger people that may open up their eyes more. But where that takes me, Karina, is that a lot of times when we have new hires to our team, okay, and if they're young, and they're kind of thinking, you're doing a lot of Botox, Dysport injections, and, I'm kind of thinking about it, what, if I were to do it, what would you recommend? And I'm looking at them and they don't really frown much like you.
Right.
One of the areas, and actually the area that I recommended on you, was I would say, let's inject the sides of your eyes. So for the older generation, we know that as the crow's feet.
Yeah.
We were being a little bit nicer. Instead of calling them crow's feet, we call them smile lines.
Smile
Okay, I don't know if there's newer terminology for that, but we would treat that. So somebody would say, well, I don't have much there, but what our staff would find is that by injecting in that area on the outside of the eyes where typically we get crow's feet, is that really opened up the eyes more, okay?
Yes.
And that's because we soften the movement of that muscle in that area. And all I will tell people, especially if you've not had Botox and Dysport, and if you just put your finger on the outside of your eyebrow and you smile, what happens is that muscle there tends to pull your brow down. That's why when we smile, our eyes kind of get a little crinkly, okay? And so by injecting Botox in that area, it helps to keep the eyes more open. I know models are really good at doing that. I'm not so good at that. My Asian eyes, they kind of disappear when I smile, but I smile anyways, okay? But I absolutely, that's my number one area that I have injected with Dysport and Botox, because because of my Asian eyelids, and then I'm a baby boomer now, I need to try to open up my eyes as much as possible.
Interesting. So would that also, I'm thinking about like repetitive movements, right? Like
Right.
crinkling the eyes, or frowning. So doing that, that does tend to leave little marks in our face, right? That's what those
Correct.
wrinkles are, right?
Absolutely.
So that preventative, even if you are a younger patient, that would be something that could sort of like help you from having those marks continually.
That's absolutely
right?
true. Absolutely true.
Yeah.
And so Botox is our number one treatment, and so we've kind of gone over what our daily what we would recommend for
Right.
those quick fixes. Is there anything else?
Yes, the holiday pout.
The holiday
pout.
Okay, yes.
Holiday pout.
All right,
That red lipstick.
we're in bonus. Okay, we're in the bonus round here. So we're
Bonus
gonna talk.
round.
We're gonna talk. We're in the bonus round. So we're talking about fillers.
Yes, let's get.
Yes.
let's
Okay.
get
So
those
the
kissable
holiday
lips.
kissable lips. Okay. So everybody it's red's a very popular color. It's the holidays, red lipstick and all, and that's having healthy looking or the
Exactly.
holiday pout. And so I know fillers have gotten a bad rap at times where they go, oh my God, the person looks like a fish. Well, let me tell you, that's not our goal. That is certainly not our style. But there are ways to use filler. And one of our favorites is Wrestle and Kiss. That's spelled Kysse, Wrestle and Kiss. And by adding a little bit to the lips, we can give somebody a holiday pout. They can look more moisturizing because it is hyaluronic gel. Remember that, everyone? And it absorbs water. So that's really a great way to plump up the lips. And I'm not talking about big, but just plump them up so that they just look prettier. They will look healthier. Okay, they will look healthier, and you'll look your best. And one of the little secrets is that we put a little bit in the lower lip. Always make the lower lip a little bit bigger, and that's what you were referring to, I think, right?
Yeah, the holiday pout.
The holiday pout. I like it. Okay, not the pout that Santa Claus doesn't like. The pout that your friends are going, oh wow, your lips look great.
People want to meet you under the mistletoe.
That's right. Exactly. That's it.
And there's always that midnight kiss. So
there you go. Oh, that's right, because on New Year's Eve. Okay, so we are. So in summary, we wrap it up here at a time. Thank you, Karina, for being with us again.
Thank you for having me again.
So
here.
really quick things that you can do. Number one, make your skin glowing, and so hydrofacial. Hydrofacial is what you said, Karina. Maybe if you kind of ignored your skin in a while, and we kind of want to freshen up your skin, another option may be a
peel.
Chemical peel. And then we talked about, these are not major capital per outlays, okay? What skincare products can help to continue to give us that glow as we move into the holidays?
Some hyaluronic gel or quench or some restore.
Perfect. And so that would be great. And then Botox Disparate, which we just talked about, and the holiday pout, which is fillers in the lips. We would love to see you. Happy holidays, everybody.
Thank you.
All right, be sure to check out Dr. Tom and book your free consultation by calling 707-542-8346. Happy holidays.
We did it.
We did it. Thank you, everybody.
Good.